Hi, Gerhard Bloom. Let's look at the question of whether social contagion is fueling this absolute epidemic in gender dysphoria and this whole transgender issue, this very damaging transgender issue. Well, the short answer is yes. This radical trans and gender ideology is fueling an absolute epidemic. It's an absolute epidemic fueled by social contagion and, yes, extremely damaging. In the current context, impressionable young minds are being shaped by trans radical activists across social media and in school environments that react with praise, encouragement, and positive social standing, as though transitioning wasn't a serious, life-altering, permanently disfiguring intervention, but seen instead as a brave political act. What might that brave political act be? Well, they are these trans adolescents who are being manipulated by this. They're challenging the rigid, oppressive gender norms. That's right. So this young child, not wise enough to understand the full implications and consequences of this, are having their bodies permanently disfigured. And parents, to the extent that they're being informed, are being lied to. Puberty blockers, it's a pause on puberty. It's not a pause on puberty. Awful. And these chemical interventions, the testosterone, these have permanent consequences. We are in the midst of an absolute alarming epidemic across Canada and across the United States and Europe. And the rates are expanding exponentially. And this the traditional clinical dysphoria had skewed strongly towards boys. That's right, not young women, boys. Basically from the age of 4, were non-conforming in terms of typical gender displays, right? They never felt comfortable in their own skin. And I am on record as saying that if you're an adult and your life is made better by transitioning, transition. There are people for whom transitioning has been the right choice. They will never properly be members of the transitioned sex, never. But if it makes their lives better, by all means. But children, no. And the statistics are clear. You leave kids alone who have gender dysphoria, no permanent medical interventions and no surgeries, the vast majority wake up one day, they discover that they're actually gay, and no, they're not members of the opposite sex at all. And you have members in the LGBTQ plus. No. You have now brave members in the gay community who are adamant against this, as are members of the trans community who are against this medicalizing of the children's dysphoria. And gay is being canceled now. Yes, the radical transgender movement is canceling gay. No, if you're a young gay boy, you're probably really a little girl, and vice versa. So gay is being canceled, and permanent disfigurement for young children is happening in adolescents. So now the phenomenon we confront is thousands, and yes, I mean thousands upon thousands of young women, girls with no previous history of gender dysphoria, gender discomfort, are waking up one day to suddenly discover that they're actually men. And the clinical evidence is very clear. The vast majority of these gender dysphoric young women and young men, it happens to a far lesser extent. It's social contagion being fed to them by the media and seduced by the trans community and being fed to them by very stupid educators. No, they're not cruelly trapped in the wrong body. Most of these people with gender dysphoria, the boys and girls, they have underlying psychological and emotional problems. And when they have these serious underlying emotional and psychological problems, they are troubled and they're looking for understanding and relief from their very real suffering. And the radical trans movement steps in and they provide them with a scripted narrative. You can solve all your emotional and psychological problems if you just transition. Well, guess what? These problems don't disappear. Transitioning does not help alleviate these problems, nor does it reduce suicidal ideation. That is a lie. And so now emotionally troubled young women predominantly are shepherded along by various social media, politically motivated trans activists, and the medical community and psychological community has been bullied into adopting a pro-trans policy. If a girl says she's a boy, then she must really be a boy. There's no attempt made to understand what might be feeding this trouble. In Canada, in the United States, psychotherapists who might want to responsibly explore what might be behind this dysphoria, they risk losing their jobs. That's exactly right, and losing their licenses. Ask yourself, what other medical condition do we allow children to diagnose themselves? Well, here's an interesting fact. Many countries across Europe have finally realized that this isn't science, it's ideology. Sweden, Finland, Spain, Britain, they're all putting the brakes rapidly on this transitioning of kids because they realize it's incredibly damaging and it's not science, it's an ideology. So girls, adolescent girls, having their breasts cut off, they're given puberty blockers, they're given testosterone. These cause irreversible changes. And in some places, this takes place without parental consent, or in some cases, against parental wishes. In Canada, you can have your children taken away from you if you refuse to provide them this necessary medical care, which is not medical care at all. It's medical malpractice. Absolutely insane. And think about this for a moment. Countless people regret getting tattoos in their early 20s. And now imagine you're a young woman who's had her breast cut off, her voice permanently masculinized, and now is infertile. That's right. Life-altering consequences visited upon children and adolescents too young to understand the full consequences of their actions and being lied to by the medical community and not told about these permanent disfigurements. Please check out my book, Deconstructing Social Justice. The issues are important, and I promise you, the book is important. And not because I wrote it because the issues could not be more important. Thank you so much for your time and attention. Bye-bye.